Welcome to Mental Health Matters. I'm your host, Chris Garrett. We're glad you could join us for this edition of Mental Health Matters, being brought to you by the Center for Life Management in partnership with the folks here at Derry Community Access Media. For our first segment today, we're going to welcome Amy Izzet. She's a coordinator of evidence-based practices at the Center for Life Management. Later in the show, we'll welcome Elizabeth Duffy, who is the Continuum of Care facilitator for the South Central New Hampshire Public Health Network. Will join us to provide information about substance use prevention and treatment services here in this region. So Amy, welcome to the show, and I'm sure folks in the community are familiar with what CLM does, but for those that aren't, could you tell us a little bit about what CLM does?
Sure. The Center for Life Management is one of the 10 community mental health agencies in the state of New Hampshire. We serve the southern New Hampshire regions, southern New Hampshire towns. There's 11 towns that we serve. We serve individuals with behavioral and mental health issues, from really young children to toddlers to adolescents and adults all the way through elderly.
And so tell me a little bit about what your role at CLM is.
So part of Center for Life Management is the community support program. And so that program works with individuals that are 18 and over who have severe and persistent mental health issues and have been found eligible within the state. So my specific role is the community aspect. So I oversee all of the community-based support staff, the direct support providers, and the different services that we provide, which some of those are the evidence-based practices, that one of which we'll talk about today, which is supported employment.
Now, and you do a lot of that, obviously, but this is outreach in families and homes as well, too, right?
Right. So we have two office settings, one in Derry and one in Salem. But the services that I oversee, those community-based services, are done in clients' homes, are done in the community, at libraries, at grocery stores, and in places of employment.
And what are some of the things that you're actually doing when you're in the home?
So it could be a range of things. It can be helping them with organization within the home, cleaning. We don't do the cleaning. It's all about independence and teaching them independent
and
skills.
Empowering them, right?
And
yes.
empower them,
Yes.
right. And to be able to help them manage their symptoms. So a lot of what we do is to help them manage their symptoms so that they can complete these tasks independently.
Now, you talked about being eligible. How would somebody find out if they qualify, or are they even eligible for this kind of service?
So eligibility is based on functioning. So basically, when you turn 18, if you have a mental illness or have been diagnosed with a mental illness, they'll do an intake to determine your eligibility based upon state guidelines for your functioning levels. And so when individuals are struggling in a little bit more than others, they become eligible within the state, and that opens up a higher level of services that they're able to receive.
You know, and I found too in my dealings with because it affects all of us. We either have friends, relatives, whatever. Recognition is one thing, and maybe the parents can recognize it, but the kids sometimes, and I'm just using children, or even if they're 18, they don't want to recognize like a sign of weakness, or they don't want to admit there's a problem. How do you navigate around that?
Well, I think the kids really do understand that there's some sort of, I think they do, especially teenagers, understand that they're feeling different. Something's going on that is bothersome to them. It's causing them some anxiety or things like that. But the schools are doing a really good job of starting to promote, mental health issues and make it more, reduce the stigma surrounding mental illness, and to get people into services and support them throughout their lifespan.
So if mom and dad are out there in the audience right now, they're saying, I think I have a child that might need some help. How would they go about finding what services you have, and then if something would be a fit for their situation?
So they would contact the Center for Life Management. We have an intake department that would ask them a lot of questions and kind of go over what's happening with the child or the adult in this matter. It can be anybody that can refer someone to services. As an adult, obviously, the adult would need to want help. We also have a lot of individuals that come to us through the hospitals. So they may, go to the hospital because they're not doing well. and then they'll be referred to the Center for Life Management.
Now, how long have you been providing the service here with CLM?
So I've been with the Center for Life Management for 14 years, mostly in that setting of the community-based services. I started out doing community-based services, and then I began the supported employment program.
And it seems like obviously there's so many different facets of programs that CLM offers, and this is just one of many great programs that you offer to help the community.
Yes, there's a lot of programs that we offer for kids, for teens, for young adults, transition age youth, and then the adult program, which is what I work in.
So it's adults and kids as well, because a lot of times you're working with the whole family too. So.
Yes, yeah. So Center for Life Management does the whole gamut.
And even senior care, as a matter of fact.
And even seniors, yes, and even
so
seniors.
What are the benefits to these programs for other individuals?
Well, there's a lot of benefits to others. For supported employment specifically, so supported employment is the program that supports individuals with getting back to work. So it's the 18 years and older. It's driven by them. It's at their pace. It is a service that we go out to them. We support them with resume development, with understanding their illness and understanding how it impacts them at work. But working is incredibly important. Working is powerful. A lot of us have, when we define ourselves, if somebody asks, who are you, Chris, or who are you, Amy? A lot of times it's one of our top things. They'll say, oh, well, I'm a mother and I'm a social worker.
Right.
And so it becomes one of our, a form of our identity. And so for our clients, being able to work gives them purpose. It gives them hope. It gives them, besides the financial piece, a lot of our consumers, they just want to find purpose, hope, value.
And live a normal life too.
And
right?
live a normal life, yeah.
And that's very important, obviously, to people.
Absolutely.
So, and it's important to parents and kids, and you guys do some great work. So, is there anything else that you talk about you think that is interesting about the job for you?
For me?
Yes.
There's nothing better than seeing, so for the supported employment program, which is what we're really focusing on today, it's one of those programs that as a provider, it is wonderful to be able to see someone that's depressed or anxious or, had failed at times at other jobs, and then be able to see them succeed and be able to see the joy on their face, because there's a big difference between someone receiving a Social Security check, in the mail and then getting that first paycheck. It's amazing to see just their whole affect changes, and working is really, really important. And this evidence-based practice that's been around at our agency since 2005 is it's a great program that helps a lot of people.
Well, and like I said, it's not a handout. You're basically empowering them to get back in the working force, to kind of manage their illness in ways that they can with different treatments, different techniques, and to kind of live a normal life and get back in community. And there's nothing like the satisfaction of them getting the job and doing that. But for you, obviously, very gratifying that you've been able to help them and give them the tools to do that.
Of course.
Now, do you guys also do help with placement in terms of, I know you have all the tools to get there with the resume building. Are there also some job referrals, or are you just kind of leading them in the right direction and the rest is up to them?
So part of the supported employment program is doing job development. So we do go out into the community and build relationships with employers and things like that. But unfortunately, there is still a lot of stigma surrounding mental illness. And so we do have a lot of individuals that don't want us to disclose that we're even working with them.
Right.
And so it is such a a consumer-driven program that will do whatever it is that they want.
Right.
So yes, sometimes we'll go into their employer, we'll go on interviews with them, we may do their orientation at their new job, but we have individuals that have bachelor's degrees, master's degrees, and so we support with education as well to help them in their career exploration and really, getting off of benefits and, doing all of the things that everyone else does in the world and wants to do.
Well,
really.
it's wonderful you guys provide that service. And I tell you must be helping a lot of families. How many families are you actually working with in a given week?
So currently in this, we work individually, but we do work with the families because a lot of times the families do have an impact on whether or not the clients want to work. Sometimes they may be told that they can't work, or some are really pushing them to work and maybe they're not feeling ready to work. So we do work with the families to try to educate them on the values of work and the importance of working. However, the supported employment is just it's so consumer driven, and so we really just do whatever we can to we'll do anything we need to be able to do to help them get that job and then keep the job,
right?
Which is another big piece.
My whole point is you get them there, and they get to this point where they've done all the work, and you've kind of, I don't want to say rehabbed them, but give them the tools to actually go out in the workforce and get a job. How's the follow-up after that?
So part of the program is that we follow the individual once they have a job. The evidence, because there's evidence behind this program, the evidence shows that typical to be most successful, 1 year of follow-along support with a supported employment specialist is most beneficial. That doesn't mean every single week. That could be once a month towards the end. Just a check-in to say, how are things going? How are you doing? Are there any issues that you're facing? Do you want to change jobs? A lot of times I'll have people that have worked with me 4 years ago and then come back and said, I'm ready to move to the next step, or I want to become a supervisor, or I want to change a career and go to school. And so we're able to do any of those things to really support them.
That has to be really gratifying for you to see, able to take somebody that has some problems and challenges and help them, give them the tools really to kind of succeed and be successful in life.
Yeah, so we can teach them the tools, but I always say it's them. They're the ones that do the work, and so it's powerful to be able to see the little skills that we're able to give them, and then how they're able to run with that and go to work and go to school and graduate and advance in their careers, and it's really great to see.
And so you've been doing this for 14 years, you said now.
14
How great
years.
is it? Have you seen people that actually started with you 12, 13, 14 years ago and how they've progressed and this has helped them over the past decade?
Oh, yeah. So I have an individual that I worked with when I first started who was able to go to school, graduate from college, and get a full-time job, get off of benefits, and is no longer in mental health services. She not this level. She moved across the country and is doing great. We've had so many success stories. We recently had a employment celebration. So last year alone, we had 56 consumers get jobs. And
Wow.
So we invited them to a nice lunch and celebrated them. And everyone was able to share their stories of where they were and what struggles they were having, and now where they are today after having secured employment and having been working. And the stories were so powerful that everyone in the room was almost in tears, because they were so open with sharing the experiences that they had, and how employment is so important to their mental health recovery.
And that must be great every year to have another graduation class come in and you get to have them back. How
Yeah.
much fun is that, Amy?
It's awesome. Wonderful.
Well, Amy, Amy Izzet here with the Center for Life Management. You've had some great stories. You've told us about people who rehab for the last 14 years, gotten back in the workforce. Are there any one story that might stand out in particular?
Well, we have one individual, which we're going to show a clip of, who is able to kind of share a little bit about how supported employment's helped him. Because it's one thing coming from me as the coordinator that loves supported employment and is so passionate about it, but to actually hear it from one of our consumers who has been receiving it for many years, I think is much more powerful.
Well, let's hear from them right here.
I've received many kinds of support in various stages. Step one was simply getting my symptoms under control so that I could go out into the world and start doing things again. Step two was, and a big one, was going back to get my bachelor's degree in English. And I had a lot of help getting started in the process, support going through it, making sure all the papers are done correctly and that sort of thing.
It's been a real pleasure having you on the program today.
Thank you.
Thank you for informing us all here on Mental Health Matters with the Center for Life Management. And now we welcome to the show Elizabeth Duffy. Elizabeth is the Continuum of Care Facilitator for the South Central New Hampshire Public Health Network. That's a mouthful. So Elizabeth, tell me a little bit about what your role is and how long you've been with Public Health Network.
Sure. So I've been doing this for a little over a year and a half now. And my role has a couple of different parts to it. I work really collaboratively with our substance misuse prevention coordinator to do prevention efforts in the community, which I'll talk a little bit more about as we go.
Okay.
And then also I keep up to date a resource guide of all the prevention, intervention, treatment, and recovery resources in the area, and that's up on our website. I look at the assets and gaps in the community, and then it's just a lot of driving around. It's a lot of meetings and a lot of talking to people about the needs of the community, so people who need resources can get them.
Yeah, and we know New Hampshire has been very aware and very hard hit by the drug addiction and the opioid crisis. In fact, I know we have a new Commissioner of Safety, Bob Quinn, and the first thing he said this week was that's one of his top priorities is the safety in the opioid crisis. So obviously you're in a hot spot of activity and a big crisis here in the state.
Yes, never a dull moment, definitely. Always busy.
Now you said you're on forums. What type of things are you doing in your role here?
So in my role, it's a couple of state level things here and there, a couple of task force that I like to be a part of, and so that way I can bring down this information that's coming from the state level down to our community for our community partners to be aware of. I've been active with the Doorways to help get that rolled out in our region, working with Granite Pathways, helping them make connections down here, and then also helping our community partners get familiar with this new process because it is brand new and there were a lot of questions about it since this region is mostly going to be traveling to Manchester or Nashua.
Right. You say Doorways. What are you talking about?
So the Doorways are that state opioid response grant hub and spoke model that was started at the beginning of this year. Back in October or November, the governor released who was going to be a part of this, and for our region at least, we have both of our locations are through Granite Pathways, and so they have the resources to help get people into treatment, and also helping them find recovery resources for once they're out of treatment, so they can stay in recovery.
So the impact's been far-reaching and touched many, many lives in our communities, whether it's directly or through family. We've all had it, whether it's a family member, known a friend of a friend.
We all know someone.
Right, exactly.
Right.
So it's rampant in the state right now.
Yes.
And what are the other things that we're trying to do to help curb that now?
So a lot of what we like to talk about is prevention. Our schools are doing a great job with prevention right now. They talk about the substances in health classes, guidance counselors. Some of them are doing DARE programs, some of them have Life of an Athlete programs, some have a student assistant programs or a social worker in the school that goes along with the guidance counselor. So our schools are really big part of this. They do the national programs like National Prevention Week, which happens in May, and then also Red Ribbon Week, which happens in October. And then parents can also be a big part of this as well, having those conversations early and often with their children. So just for example, if you have a 4-year-old who's sick and they're taking medication, you can talk to them about, oh, well, we're taking this medication because you have X symptom, like a fever or something. Right. And we're only going to take this medication the way that the doctor prescribed it, and the doctor said it was okay for you to take it, and then once we feel better, we're not going to take it anymore. And then just as they get older, you can start to go more and more in depth with it. And then also monitoring screen time, and then also monitoring the apps, because unfortunately everything is on YouTube and Instagram right now. Yep. So just being aware of what your kids are looking at. And then I think that the family dinner aspect is always going to be important.
Great idea.
Even if the teenager is just rolling their eyes and saying, my day was fine, please leave me alone, Mom, they're still important. You want to have those just so that way they know that somebody is there and that will listen to them. And then also, if a teen has a sports injury or wisdom teeth removal or something like that where they get a pain pill prescription, the parents should be in charge of that pain pill prescription. So monitoring that, and then that's another teaching moment. You can talk about the same things that you would tell somebody more but more in depth, talk about the dangers of using this drug, not the way that the doctor said to do it. And then, you know, if there's any left over, the parents can bring that to one of the safe disposal boxes that are in the community. So
Yeah, we just had the take back.
Yes.
We had the day on Saturday, or
Yes.
actually this early last month, and now of course you have the boxes all over the state, which are
right,
a
so
very important way to get rid of this stuff and make sure we can control it.
So almost all of our communities in the South Central region have a permanent drug drop box at the police station. And the only ones that do not in this region is just because they're really small. So it gets a little hard. Unfortunately, Chester and Danville don't have one, but all the other ones have one. And then there's also a new one at the Rite Aid in Derry over by Parkland.
Okay. Now, we talk about kids. Mom and Dad, are there any warning signs, any tips? What should mom and dad be looking for in terms of behavioral activity, changes in behavior from their children that might be a tip-off there's a problem?
So that's where it gets tricky,
Right.
because unfortunately, any of the signs that I could tell you could also be indicative of something else. Maybe there's a stressor going on at school, or maybe they're starting to exhibit mental health illness signs as well. So when we talk about signs, it could be a substance use disorder, but I wouldn't want parents to automatically jump to that. So I would say if you notice these signs, have a conversation with your child. Don't rule it out, but don't automatically assume it. So those signs are, like you said, changes in behavior, changes in, you know, if they start to not be interested in things that they used to be interested about. If your teen used to be really into fashion and always had really clean clothes, and then all of a sudden they're just wearing sweatpants, that could be a sign. And then also if they stop showering, if there's any physical changes like weight gain, weight loss, that sort of thing, having a hard time sleeping, and then this is more for older adults, but if they start having money management problems, that could be a sign as well.
Well, withdrawal, there's a bunch of different things that can happen that way.
Right, right.
Now, is there a certain age that you should start to think maybe after this you might want to start look for some warning signs?
Unfortunately, substance use disorder does not know age.
Knows no age.
It knows no age. Unfortunately, it can happen at any point of our lives. But we know that prevention helps. And we know that the earlier you start taking a substance, the more likely you are to have an issue in the, as you go through life. So that goes back to having those discussions with your kids early and often, and having an open dialogue with your child. So if another thing is if there is a history of substance use disorder within the family, a teen should probably know that,
right?
Just so they can be aware.
Now, are you working? I know you have a lot of programs. So you're working with the schools and the government and a lot of the agencies and boards to roll education out and help with this? Is that what you're doing in a lot of different areas?
I myself don't work much with the schools. The Substance Misuse Prevention Coordinator has been doing a lot of the school work, and she's been really active with helping them with their National Prevention Week activities and their Red Ribbon Week activities. So she's doing more of the school aspect, and I'm kind of doing more of the government kind of work.
And together, you work together. But are there any other prevention programs in place in terms of helping to curb this that you're working with?
Yeah, so the Upper Room has their Young Adult Strategies program, which is for the 18 to 25 age group range. It's kind of that weird transition period where they might be going off to college, or they might be moving out of mom and dad's house, and they're suddenly on their own, and they just need a little extra help.
Yeah.
And, you know, obviously they'll be turning 21 in that time period, so it's new and exciting, and just helping them be more mindful about making healthy decisions in that age group.
Well, that's some great work. You're very passionate about what you do, I can tell.
Yes.
obviously.
Yes.
What were you doing before this?
So I was actually doing underage drinking prevention in Massachusetts under a grant down there.
So this was a perfect natural progression.
Yep.
Well, if someone has a family or loved one they know needs help or treatment, what do you think they should do? What would the steps be?
So I would say call 211. Okay. 211 has support clinicians 24/7 available to help direct people to what they might need to do. If the person who thinks that they have an issue themselves is the one calling, they'll often try to get them to go to one of the doorway locations if it's during open business hours. Right. The Granite Pathways locations in both Manchester and Nashua are open 8 a.m. to 11 p.m. Monday through Friday, and then 11 to 11 on Saturday and Sunday. So they have a lot of time period, but we know that crises usually happen at like 3 a.m. So
It's never on schedule,
no,
right? Of course, you can't
there is
plan this
never
stuff.
a crisis during normal business hours, unfortunately. But they can still call 211, and the state actually has a contract with Dartmouth, and they have people available to talk during those wee hours of the night, and they can help them get, find a stable place to sleep for the night and try and get some of that paperwork started and then fax it over to the doorways, and hopefully they'll go to the doorways in the morning when they
So,
open up.
it seems like all these agencies, doorways, pathways, 211, how long has that been? Because I've never heard of 211. I'll be honest that I've never heard of 211.
Yeah, so 211 has been around for a while, but they've recently started doing kind of a revamping thing. It's in New Hampshire, at least.
Right.
It's an initiative of Granite United Way. They've hired new staff, they've hired a new director, and they're really trying to get it more in the communities. And that's really where the state is going to be pushing the marketing campaigns as we move forward. And then the doorways, like I said, had just started back in January, and they are up and rolling and ready to accept patients.
Now, do you work with families at all, too, or no?
Not as much as I
Not
would
in
like. I do, myself and the substance misuse prevention coordinator host community educations, like Narcan trainings, and then substance-specific educations for parents or the community as well. So that's kind of been the extent of mine with the families. I'm hoping to do more.
Right. And are you working with law enforcement as well? Because you talked about the
Yes.
Narcan, which is obviously a
Yes.
big thing in helping keep these people alive at this point.
Yes. In the past, our Narcan trainings have usually been our presenter has usually been Chuck Hemion from the Derry Fire Department.
Okay.
So we have a very close relationship with the police and fire in all of the towns in our region.
Now, what area are you working? What's your coverage area, basically?
So we have 10 towns, and it's Atkinson, Chester, Danville, Derry, Hampstead, Londonderry, Plastow, Sandown, Salem, and Wyndham.
You did very well with that, by the way.
I can only do it if I do it alphabetically. Otherwise, I'm going to miss stuff.
That's great.
Yeah. So those are the 10 towns that are within the South Central region.
And you super serve them, basically, here.
Yes.
And you love what you do?
I
It looks that way.
do. I do. I really love my job.
Now, when you work with the government as well, are you working? Are you going to? You talked about working with the. Are you going to the government? Are you going to get legislation passed? Are you working with that type of stuff as well?
Here and there, as much as I'm able to. I try and go to state hearings so that way I'm at least aware of what's going on from the top level and be able to bring that back down. Myself, and this isn't necessarily a continuum of care facilitator kind of role, it's more of a personal interest. I go to the Governor's Commission Joint Military Task Force meetings, and then that's been really good to think of ways that we can help the veterans and our families and our active military members here in New Hampshire.
Well, Elizabeth Duffy with the Southern New Hampshire Health Network, it's been a pleasure for you educating
Thank
me and
you so
everyone out there
much.
today. So the Center for Life Management has locations in Derry and Salem. To contact the CLM, you can call 603-434-1577 or visit centerforlifemanagement.org. Thank you for joining us for this edition of Mental Health Matters. I'm Chris Garrett, and we'll see you next time on Mental Health Matters.